Hello, and welcome to Community Pulse. Community Pulse is a public affairs show about public health in the city of Chicago. This is the long part, so try to follow me. Okay. Community Pulse is sponsored by the Hectone Institute of Medicine, a public health care institution in Chicago for the last 80 years. Community Pulse is a partnership between Hectone's Nurses in the Humanities program, the Healthcare Council of Chicago, and the Foxglove Alliance. And my name is Levi Moore, and I'm the Foxglove Alliance coordinator. Today, our guest is Melissa Maguire, the executive director of the Illinois Association of Free and Charitable Clinics. Melissa, welcome to Community Pulse.
Thank you, Levi. I look forward to talking with you today.
Okay. Now, it seems like I have to do this on every one of the shows. Okay. It's not like we don't know each other. Okay. The Foxglove Alliance consists of 15 healthcare organizations in Chicago. And the IFCC is a member of the Foxglove Alliance. I am also the co-chair of the Policy and Advocacy Committee for the Illinois Association of Free and Charitable Clinics. We're going to call it IFCC. And I'm also on the board. So what you're going to witness is essentially a peek at a conversation between two colleagues. So with that out of the way, the housekeeping, so let's get started. So Melissa, before we get into that, who are you? How'd you just tell us about yourself.
So I'm the executive director of the Illinois Association of Free and Charitable Clinics, and I've been fortunate to be part of the state association for 7 years. And what we do at the Illinois Association of Free and Charitable Clinics for the clinics in Chicago is we provide resources and networking to help increase the capacity of our clinics and also increase the awareness of the importance of our clinics. So prior to working at the Illinois Association of Free and Charitable Clinics, I also worked at the night ministry. So I'm excited to be part of this community that is providing very vital health care to the uninsured in the city of Chicago.
Okay, now let's get into, because a lot of times people get confused. Mm-hmm. So there are free and charitable clinics, there are federally qualified health clinics. Mm-hmm. What is the difference?
Sure, that's a question that we get all the time. So the free and charitable clinics are private, non-for-profit organizations that provide primary health care, dental care, behavioral health care to the uninsured. What separates from the free and charitable clinics to federally qualified health centers is free and charitable clinics do not receive federal funds. Mm-hmm. At this particular point, they get some state funds, but the majority of the resources for free and charitable clinics come from donations and come from fundraisers. Their primary role in providing health care is really as a community response. So what you'll see with free and charitable clinics is they really reflect the community in which they serve. So here in Chicago, we have 20 free and charitable clinics. And in Chicago, the diversity that you will see in the clinics really reflects the community that they serve. We're fortunate to have the largest free clinic in the city of Chicago is Community Health. And we also have mobile clinics like the Night Ministry and Mobile Health Care Clinic, where they provide health care on the streets and or in designated communities in a mobile unit. But at the same time, we have clinics that have been, the communities might be mosques or churches that say, for our community, we really need to have health care provided in this neighborhood, and doctors get together and form a non-for-profit and provide health care specific to the needs of that community. In some areas, some of the doctors have identified need for more asthma care. In some of the cities of Chicago, we'll see that there's a need for that. In other communities, you'll find that some of the providers have gotten together and identified that the patients that come to their clinics do not trust any traditional healthcare system, and so they are ingrained in that community to provide healthcare that's very safe and welcoming. And so the clinics really reflect the community in which they serve. It's a very diverse group of clinics, and they provide a wide range of resources to include pharmacy and access to medication. So it's a very strong part of the safety net. How that works with federally qualified health centers and other community health centers is, in many cases, when patients come to free and charitable clinics, what is part of the care that's received is identifying any other healthcare resources that are available for those patients. So in some cases, it is referring them to federally qualified health centers or other communities. In some cases, it's working cooperatively with. So in many instances, our clinics are really the important gateway for quality healthcare for those that don't typically trust traditional healthcare systems, and then we're the bridge for those patients that qualify for other healthcare services and getting them to trust the healthcare system and access the other healthcare services.
Okay, for someone that might be undocumented, can they go to a FQHC, or is that a limitation?
It is not a limitation. What sometimes can be a challenge is there could be times where there's, in certain parts, not so much in Chicago, but in other parts of Illinois, there might be wait lists, or there might not be a federally qualified health system, and or, like I said, there might be wait lists. So what free and charitable clinics do, and anybody can get care at a free and charitable clinic regardless of their documentation status, and they provide that quality health care for that person, for that family, while they are assessing and identifying, are there other healthcare resources that that person can be referred to. So, when, just like a week ago, I got a call. There's a few of us at the Illinois Association of Free and Charitable Clinics where we have our phone number is on different resources if you're looking for health care. So I got a call from somebody whose relative just arrived from another country, and that person was looking for a health screen. Right, just wanted to see a doctor. And so I was able to talk to them about the resources that are available for them, to include a clinic in their community. And when they go to that clinic, they were able to get access to a physical look, and they were identified that the person had hypertension, so they were able to get some of their immediate hypertension needs met, and at the same time identify any other healthcare resources that person could qualify for. But because that clinic represented and looked like the community in which this person came from, that relative felt very comfortable initially going to a free and charitable clinic, to a free clinic in Chicago.
When you say free, is it really free?
It's really free. There's no fee for services. In Chicago, all of our clinics are free. And so that would mean if somebody is looking for medication, their medication is free. The care is free. Many of our clinics, when there is a need for specialty services, they network with other hospitals or other providers for that person to receive care through specialty services. And all of that care is free to the patient.
Do any other clinics provide dental assistance?
Some of our clinics do provide dental assistance, and that is truly a need that we see now more than ever. Again, back to the phone calls that is coming to the Illinois Association of Free and Charitable Clinics. Actually had a call from somebody who had a root canal, who needed a root canal, and there was a 9-month waiting list. And I can't imagine being in pain for a root canal and waiting 9 months. And so some of our clinics provide dental care. There are dentists on site, and they're able to get some of their dental care taken care of with a much shorter wait period. We also do dental screens. We'll get calls where people will say, before I can have this surgery done, I need to have a clearance in a dental screen. And so they can come to a clinic and see a dentist and get clearance so that they can have some surgery done.
Okay, and I know we don't want to talk about this too much now, but it was really the biggest healthcare situation in my lifetime in New York City. What role did the clinics play during the pandemic?
Yes, so for many of our clinics, when the first initial wave of really looking for testing. You know, initially it was getting the tests out there and getting the patients of the free and charitable clinics tested. Many of our clinics, because our clinics are nimble and adaptable, that's how they've always provided health care. So what they did is they were able to adapt and identify the ways in which they could provide COVID testing. Now, what we would say is initially, in Illinois and across the country, the free and charitable clinics were not in the federal radar to receiving COVID testing. The state of Illinois reached out, and we worked with some of the health departments in the state of Illinois. And so for the free and charitable clinics, particularly in Chicago, a nimble response true to the free and charitable clinics form is they did pop-up testing sites, or they did testing sites in the alleys so that their patients could be tested. As we know, many of the patients of free and charitable clinics are people that live in poverty and who have had the most adverse reactions to COVID. So testing and understanding their testing status was critically important. Once the testing, we were able to get in the pipeline to receive tests and do consistent testing, then some of our clinics were able to partner with community agencies and themselves and provide COVID vaccines. And because they are the trusted healthcare provider, they were able to spend some time with somebody that might be hesitant to receiving a vaccine and really talk to them about the vaccine and help that person have an educated response to receiving the vaccine. Fast forward to care, if for some of our patients, particularly those that have chronic healthcare conditions, many of our clinics partner with other healthcare providers so that those patients that had COVID and had chronic health conditions related to COVID could receive some constant or continuous care. For many of the patients of our free and charitable clinics, the only place they trusted was that doctor that they saw at that clinic. And having that doctor sit down with them and or that nurse practitioner, that community health worker, those were the people that were the trusted messengers that they would talk to.
Okay, now post-COVID, there's this little thing called Medicaid redetermination. Can you explain to our viewers, what that is, how it can impact them, and if they are uninsured or underinsured, how going to one of your member clinics can help?
Sure. And so it's the federal mandate that during COVID, there was more of a release of a need for people to re-enroll for Medicaid actively. It was a passive enrollment. If you got Medicaid and during the pandemic, you were re-enrolled year after year after year. That has since been lifted. And so that starting in the spring, those people that have Medicaid will have been informed when their Medicaid is needed to be re-enrolled. So it's an active enrollment. And so the state of Illinois has done a fantastic job reaching out and education and has partnered with free and charitable clinics to help us get the message out that if you have received Medicaid in the past and you haven't re-enrolled, going forward, you're going to need to actively re-enroll. And so through the Illinois Association of Free and Charitable Clinics and our partners, we've been doing public messaging about where people can find information about re-enrolling. If, however, the reality is there is a missed opportunity for re-enrollment, or there is a concern about re-enrollment, or a lack of trust about re-enrollment, and that person has a chronic health condition or a health concern, they can go to a free and charitable clinic to receive health care. And again, while they're at the clinic receiving health care, once again, the clinic will also talk to them about Medicaid redetermination, the need for them to enroll, and work as the bridge to assist them in understanding that and help them become informed of their enrolling in Medicaid. But in the meantime, their health conditions don't stop because they don't have health insurance. And so the clinic can provide that vital health care.
Okay, and anybody that might be in that gap, I know something that's really critical. Let's say what about prescription drugs? and I'm sort of in between, in a limbo thing, waiting for a determination. Can the clinic help in that situation?
The clinics are there to assist and provide the healthcare needs of that patient, and also to identify where that patient might be connected with other healthcare services. So if a patient comes to a free and charitable clinic and they don't have health insurance, or they've lost their health insurance and they need medication, some of our clinics have a pharmacy on site. Some of our clinics have relationships with other charitable pharmacies where patients can go and get pharmacies at no cost. So our clinics have medications to manage chronic health conditions, and as a patient of a clinic, you would have access to that medication for free.
Okay. Well, it's not like I wasn't on the Zoom calls. Okay. We're dealing with something pretty big right now, and I think the last number I heard was that there have been 11,000 people who have come to Chicago who are seeking asylum. And there's this waiting period where people with chronic conditions, children, pregnant women, and what role are the clinics doing in that instance?
Many of our clinics are on multiple levels identifying other healthcare providers that are providing healthcare and defining the gap where the services are needed. So in some cases, some of our clinics are literally identifying if a healthcare screen is needed in a police department and partnering with the health department or partnering with other clinics or partnering to go to the police departments and do some of the health screens. Other clinics are identifying if it's medication that's needed. And so we know that Chicago has a coordinated or is working towards a coordinated response for healthcare, and free and charitable clinics play a vital role in responding to understanding what the community needs are. What I would say is, if somebody knows of somebody that is in need of healthcare, if you go to our website at illinoisfreeclinics.org, you would click on Find a Clinic Near Me. And the only criteria is that the clinic is open, right? And you can contact that clinic and say, this person, I either know of this person in my neighborhood or I've seen them in the park, and call that clinic. And in many cases, the clinic will help you identify what resources either they can provide or they know of that can provide health care to the patients. We can serve, the majority of our clinics serve adults. However, we have some clinics that serve children. And if they don't serve children, again, they partner with those healthcare providers that can provide care for children.
Yeah, because coming up, I don't want to burst anybody's bubble or make them sad, but summer started, but we're going to have to start thinking about going back to school. And what can an uninsured, underinsured mom or dad, can they get the necessary back to school screening for their kids?
Some of our clinics do screening. Some of our clinics, again, partner. And so we have some clinics that actually provide mobile care that park outside of the schools and partner with the schools and the doctors. The doctors and the nurses can provide back to school screens. Not all clinics can do that. That's why we encourage you to call ahead and identify. And again, if they don't provide that, they definitely have a list of resources that they can refer you to. And it's critically important that people understand that having those screens done or having those back to school physicals really can be done, so that's not a barrier to get those students back into school.
Oh, one other thing too, can you, is there a phone number people can use, and can you repeat the website?
Sure. The website that we are encouraging people to use is the illinoisfreeclinics.org. And when you get on that website, it'll say Find a Clinic, and you click on that button. And there's a list, there's a map, so you would identify that. But I would say to you that many of our clinics don't have geographic descriptions. Some of the clinics, certain communities feel more comfortable going to that clinic. So a case in point, the Indian American Medical Association Free and Charitable Clinic will see anybody that feels comfortable going to that clinic. Community Health will talk about provides health care to people from all over the city of Chicago. So go to the website and identify, find a clinic. go for a clinic. We also have some specialty clinics like Chicago Women's Health Center that specializes in care for women and for trans and for LGBTQ populations. So if you feel more comfortable going to a healthcare center that has really looked at providing care for that population, that's where you would go to.
Okay, and also make sure that check the clinic's hours, because all are not open every day, right?
Right.
Okay, what's going on in August? What's going on next month?
August. Well, August is the Free and Charitable Clinics Month, and the intent of the Free and Charitable Clinics Month is to increase the awareness of the great care that free and charitable clinics provide, to do outreach, to let people in the community know about healthcare, also to help recruit volunteers, because that's an important part of free and charitable clinics, and as increase the awareness of the important role that clinics play in the vital safety net for the uninsured in Chicago.
Okay, tell me about, let's just talk about like where you see IFCC going in the next 2-3 years, because I have to say you have done a phenomenal job. I've personally been working with the IFCC for probably about, well, it's actually 6 years, because my second day on the job, my boss, Dr. Dene, said, can you do something to help these free clinics, because he used to volunteer at a clinic. So looking at where you were, where do you foresee IFCC?
So thanks to a great board, Levi, that you're on, we really foresee the Illinois Association of Free and Charitable Clinics to continue to support our clinics in providing the vital care that they provide for the uninsured and the communities that they serve. At the same time, we are really looking at what can we do as a state association to address systemically what are the barriers for healthcare for the uninsured, particularly those people in the marginalized communities. So we are looking at partnering and networking and looking at policies that increase access to care. So it's strengthening those clinics, and it's looking at systemically what we can do on behalf of the patients and the communities that they serve.
Okay, great. Oh, and just to let you know, okay, we're actually shooting this show in July to get ready for August, which is Free and Charitable Clinics Month. Now, the next episode of Community Pulse will be my fellow co-host, Megan Phillip, who is with the Healthcare Council of Chicago, and she is going to interview Steph Wilding. Steph is the Executive Director of Community Health, which, guess what, folks, we have another thing in Chicago to be proud of. Community Health is the largest free and charitable clinic in the United States. And the work that they do is just absolutely phenomenal. So it's about time for me to wrap up. So, Melissa, once again, thank you for being our guest on Community Pulse. Thank you to CAN-TV and Not-for-Profit Services. Oh, I also need to mention, too, I forgot one of my little affiliations there, but yes. I'm also the chairman emeritus of the CAN-TV board, so this is like one of my favorite places to be. And that's it. Keep watching Community Pulse. You can watch us on CAN-TV Channel 26, or you can also stream. So with that, have a good day, evening, and look for Megan and Steph in the next episode.